Thomas Achin to start with a word of prayer.
നമുക്ക് പ്രാർത്ഥനയ്ക്കായി എഴുന്നേറ്റ് നിൽക്കാം. പിതാവിനും പുത്രനും പരിശുദ്ധഹായിക്കും സ്തുതി ആദ്യമേകം തന്നെ. ആമേൻ. സ്വർഗസ്ഥ പിതാവേ, ഞങ്ങളങ്ങേ സ്തുതിക്കുന്നു, സ്തോത്രം അർപ്പിക്കുന്നു. ഒരു വ്യാഴാഴ്ച ദിവസം കൂടെ ഞങ്ങൾക്ക് ഈ ആൽഫി തിയേറ്ററിൽ തീർക്കൊടുവാൻ കൊണ്ട് ദൈവം സഹായിച്ചു. ദൈവത്തിൻ്റെ സാന്നിധ്യം ഇന്നും ഇവിടെയുള്ളത് ഓർത്ത് നന്ദി. ഇന്നത്തെ ക്രിസ്റ്റിന് നേതൃത്വം വഹിക്കുന്നതായിട്ടുള്ള ഡോക്ടർ ആൽഫിയും നീത്തുവിൻ്റെയും ടീമിൻ്റെയും ഞങ്ങൾ ഓർക്കുന്നു. ഇന്ന് ഞങ്ങൾ കേൾക്കുന്ന കാര്യങ്ങൾ ഞങ്ങൾക്ക് മനസ്സിലായി. ഞങ്ങൾക്കും ഹോസ്പിറ്റലിനും അടുത്ത തലമുറയ്ക്കും ഞങ്ങളുടെ ദേശത്തിനും ഒക്കെ അതൊരനുഗ്രഹമായി തീരുവാൻ സഹായിക്കണമേ. ഓരോ ദിവസവും പ്രത്യേകിച്ച് വ്യാഴാഴ്ച ദിവസങ്ങളിൽ ഞങ്ങൾക്ക് പുതിയ പുതിയ കാര്യങ്ങൾ പറഞ്ഞു തരുവാൻ തക്കവണ്ണം ഞങ്ങൾക്ക് വേണ്ടി ഒരുക്കിയിരിക്കുന്ന ഈ പ്രത്യേക ക്വസ്റ്റിന് വേണ്ടി നന്ദി അർപ്പിക്കുന്നു. ഇഷ്ടമുള്ള സമയം തിരുസന്നിധിയിലേക്ക് ഏൽപ്പിക്കട്ടെ. അങ്ങനെ ഞങ്ങളെ നടത്തിക്കട്ടെ, നയിച്ചാട്ടെ. യേശു ക്രിസ്തുവിൻ്റെ വിലയേറിയ നാമത്തിൽ തന്നെ. ആമേൻ. പ്ലീസ് ബി സീറ്റഡ്.
As important as today's topic is, today is also a very, very important day for us. The day when our director was born. He's not here with us, but wishing him a very happy birthday. And it's a huge privilege for each one of us to work with him, work under him, and what a blessing it has been, a decade of excellence. So, from crib to confidence, identifying red flags, early intervention and smart parenting. How important this is for each one of us, especially we parents. And we would like, even before starting, we would like to thank the team for thinking this out, for planning this out. And we have none other than Dr. Alphy Christinne Thomas, who is a developmental pediatrician, a specialist pediatrician, who is going to talk to us about this. And also we have Miss Neethu, who is our developmental therapist at our Believers Nehadram Child Development Center. So we have two specialists here to help to navigate us through this very difficult area that is parenting. And with this current scenario, what the world is heading to, all the explosion of social media and drugs and whatnot, it's all the more important that we listen intently about parenting. So on that note, let me hand over to Dr. Alphy. Over to you, Dr. Alphy.
Good morning, everyone. Thank you so much for being there, though the audience number is a little less, but it's good that at least some of them are there. So thank you for giving us an opportunity to create awareness on developmental concerns in children, something on autism, especially during this Autism Awareness Week and Autism Acceptance Month. So before you all wonder if I'm going to dive into complicated theories or concepts on autism, let me tell you that it's nothing of that sort. It's just going to be something very practical, very relatable as a parent, as a doctor, or maybe as a family member to each and one of this child. So whether you're a parent or a teacher or a student, a friend or someone who wants to do something better for a child whom you meet, maybe this presentation is just for them. So I think this is a need of the hour and we shall go to the presentation directly. So the topic for today is from crib to confidence. That is mainly identifying the red flags, knowing the normal development, know what is early intervention, and what is a smart parenting. So this is the sole aim of this presentation. That's to create some awareness about various developmental delays and the normal development, but specifically about autism spectrum disorder. Help everyone, each and every one of you, identify at least one red flag sign a child presents to you with, and what is the need for early interventions. Okay. April 2nd is being celebrated as the Autism Awareness Day every year. So it's quite natural that you have been hearing so much about autism in the month of April because that is the National Autism Acceptance Month. So the theme for this year's Autism Awareness Day was Empowering Autistic Voices. So unless and until we know more about autism, unless and until we know how to diagnose what an autism spectrum disorder is, unless and until we know what the different traits with which children present with, we won't be able to raise our hands to support them. So that's the main aim of this particular presentation. That is, it's basically an awareness program. So what is autism spectrum disorder? What is it, why is it, and what can we do about it? We see in all textbooks of pediatrics that it is a complex neurodevelopmental disorder. We also see two complicated sentences every time. It is characterized by impairments in social communication and social interaction, and it's also associated with restricted and repetitive patterns of behaviors, interests, or activities. So let's talk in detail about these 2 points. So what do you mean by a social communication? What do you mean by social interaction? What do you mean by an impairment in both of this? So suppose you have a 6-month-old baby in your home, like you're playing with the baby. What do you normally expect from that baby? You want the baby to smile joyfully at you. You want the baby to look at you. You want the baby to be very playful. You expect the baby to be very happy when you start cuddling them. So you find that a baby has got a poor eye contact. The baby is not even looking at you. The baby has got a poor social smile. The baby is not interested in whatever noises you're trying to make. The baby is not giving a reciprocal response to whatever you're trying to do. That shows that there is something wrong with the social communication or the social interaction. Or when you look at an older child, suppose most of you have kids who are going to a play school or an LKG session or a first standard. So when you ask the teacher of the play school or the LKG about your child, sometimes some parents say that the teacher said he's a very calm child and he's very calm, doesn't disturb anyone, he sits idle, he just keeps playing with some toys that he has. Is it normal? Is it something to be happy about, or is it something to be worried about? That's the question. So there comes the importance of this group play. What do you expect from a child who is a 4-year-old or a 5-year-old child? You expect that the child has a common interest just like other children of that particular age. They have a common toy. They might be fighting for the toy. They might be snatching the toy from each other. And in the end, they'll make out a way and then maybe they'll start sharing their toy of interest. So that is something called as a group play. In this picture, you can notice, though it's not very evident, but you can see that these 3 kids are playing with the blocks because it's a common interest for all 3 of them. But there is someone else who is sitting in the same room, in the same scenario, but he is playing with his particular toy, the one toy with which he is happier. So that is something is called as a solitary play. That is, he doesn't have a group play. So that is something to do with an impairment in a social communication or a social interaction. Then one major complaint with which most of the parents come to the OPD is a poor language or a poor speech. Some parents come to the OPD at 3 years of age, and then maybe my fellow pediatricians will be able to say it more clearly because they come with a pneumonia or maybe some other illness and get admitted in the hospital. And when we ask about the development, they say that, no, he has not yet started saying papa or mama, but he makes sounds. He says Dora. He says poopy. He calls everyone Dora. So I don't know if that is something to be happy about, because what we normally expect from a child is that he should be able to say appa or amma by the age of 1 year. That is, at least 2 meaningful words are supposed to be there or expected to come from a child who is 1 year old. So waiting till 3 years of age to hear him call everyone Dora or Poopy is not something that is acceptable. So that has to be identified at 1 year of age itself, or maybe by 1.5 years, that he is having some sort of a speech delay. Maybe if you're the parent, it's just a speech delay. But when we look at it in detail, it may be something to do with the impairment in a social communication. He is not having a reciprocal communication. He is not having meaningful words. Maybe he is just repeating the same thing that he heard in some cartoon or some mobile show. Okay, so then we'll move to the next point, associated with restricted and repetitive activities. What do you mean by restricted and repetitive activities? Suppose you have a 4-year-old child in front of you, you give him a dairy milk or a chocolate or a toy, he'll be very happy, and some of them will start showing or flapping hands, waving hands to show his excitement. Is that normal or abnormal? What do you feel? Is that normal or abnormal? Anyone? It is normal. But when does it become abnormal? Suppose you notice that a child keeps sitting in a room, he keeps muttering to self, he's just enjoying some sort of things that are going on in his brain, and he just keeps on flapping his hand. He just keeps closing his ears whenever he hears a loud noise. At home, you can see that whenever the mixer grinder is switched on, he just keeps closing his ears because he's having sensitivity to such sounds. Or he keeps jumping. He keeps having the toe working even at 5 years of age. He keeps spinning around in the room. That is, he is very much interested in the rounded objects. He is very much interested in the spinning activities, the rocking movements. All those things are the restricted and the repetitive patterns which he shows. Then one example is shown here. That is, he has a particular pattern in which his toys should be aligned. That is, lining up. This might be seen in a child who has an autism spectrum disorder. It's not that your child shows one feature among these and then you classify him as one having an autism spectrum disorder. No. Maybe most of us will have one or the other of all these characters. But when you notice that the child is having impairment in social communication, he's having all sorts of repetitive activities, he's having restricted interest, he's having poor eye contact, he's not having a good social communication, he's not behaving in the way he is normally expected to behave, we start thinking if it is something like an autistic trait or not. Okay, it's as simple as that. So we don't have to keep on going with the definitions, but know that these are the main things with which you can identify a child having an autism spectrum disorder. So when do you doubt? Before that, we'll go to the reasons. Why? So this question, why, is being asked by most of the parents who come to the OPD. But the fact is that the exact etiology or the exact cause for this particular disorder has not yet been fully understood. We just say that it's a multi-factorial thing. There is an influence of the genetic factors, the familial factors, neurobiological and neuropathological factors, as well as environmental factors. So this has been evidence from the various studies which have been done, which show that there is an increased incidence of autism spectrum disorder among siblings as well as twins compared to others. Or maybe in those families where there is a psychiatric illness or there is a elderly with a learning disability or a developmental disorder, maybe they are at a higher risk. Or sometimes the various neurobiological and neuropathological factors have been brought into light when incidentally some MRIs were being done because of the concomitant seizure disorder. Some found that there is something to do with the size of the brain, size of certain parts of the brain, the corpus callosum, some neuronal connectivity issues were found out. So the exact etiology is still not known. But it's definitely something to do with all these various factors, a mix of all these various factors. What we would like to highlight is the environmental factors which play a role in it. So we'll come to it in detail. So when do you doubt? Just like we expect from a normal child. At 2 months, all pediatricians say that the child should have a head control. Or maybe maximum of 3 months. At 4 months to 5 months, the child is expected to have a rolling over. At 6 months to 8 months, the child is expected to sit. On his first birthday, the child is expected to stand without support. We know that if there is a delay in any of this, it is something abnormal. Then why are we refusing or why are we not showing our interest in the cognitive milestones that the child is supposed to attain? So these are the situations where you should doubt. At 6 months, if the child doesn't have a big smile or a joyful expression and has a limited eye contact, have a suspicion. At 9 months, the baby doesn't have a reciprocal sharing of sounds, smiles, and other facial expressions, definitely have a doubt. At 10 months, if the baby doesn't have a response to name, or if the baby doesn't respond to his name being called aloud, definitely have a doubt in your mind. At 12 months, that's on his first birthday, he doesn't give a tata. He doesn't show interest when he is being given football or something, a ball is kicked to him and he doesn't kick it back to you. If he doesn't have a social interaction with you on his first birthday, definitely something is wrong. At 16 months, he has no meaningful words. We gave some time, we gave some allowance, but even by 16 months, he doesn't have a single meaningful word. Have a suspicion. At 18 months, he does not have any pretend games. What do you mean by pretend games? He just takes a cup and shows as if he is drinking from the cup. He just takes a toy phone and says, hello, just like the mother and the father uses a mobile phone. So if he is not having that pretend play, have a doubt. If the child doesn't have any meaningful phrases or even words by 24 months, definitely have a doubt. If the child has a loss of the previously attained milestones at any age, that is a developmental regression. A developmental regression or any issues which have been explained here, together with an impaired social communication or a restricted and repetitive activity, definitely the child needs a screening, because that might be an early feature of an autism spectrum disorder. So, what are the assessments and the management we do? The main thing that we have to understand that is that it's not a disease, it's a condition. What do you mean by it's not a disease, it's a condition? It's not a disease like a pneumonia, or it's not something like malaria or typhoid where you give the particular medication or you give the antibiotic and the child is completely cured of the illness. It is a condition. So I would rather say, we often say that your child has been diagnosed with autism, but is it a true diagnosis? It's not a diagnosis, but it's actually a rating of your child's behaviors. That is, we are using a tool, we are finding out where your child stands. Okay, so for that, we use different tools like MChat, that's a screening tool. MChat is a modified checklist for autism in toddlers. We have something called as a TABC, that's a Trivandrum Autism Behavioral Checklist, which was developed in Kerala at our own Child Development Center at Trivandrum by Dr. M.K.C. Nair. We have diagnostic tools. If the screening turns out to be positive, they are the DSM-5, the CAS-2, that's a Childhood Autism Rating Scale, the ISA, the Incline tool. Whatever the tool be, we are supposed to do a rating or scoring of the child's behaviors and give them a mark. To understand it better, I have given a copy of the MChat. You can look at the questions that are written over there. The first question, if you point at something, then does your child look at it? That's one question that we ask the parent. The second one, have you ever wondered if a child might be deaf? So these questions, all these 20 questions are just based on the clinical symptoms which I have already explained. So we give a score, whether the parent replies yes or no, we give a score at the end of this test, and then based on the scores, we tell them if it is positive or if it is negative. The screening is positive or negative, and then we move ahead with the diagnostic tools. Then there is a question, is MRI, EEG, or any medication having a role in an autism spectrum disorder? There definitely is, but especially that occurs when a child has an autism spectrum disorder with a concomitant seizure disorder. Or the child has an autism spectrum disorder with a dysmorphic facies. He is expected to be a syndromic child, like on evaluation he turns out to be having a genetic syndrome or a chromosomal abnormality. In such children, there is a role for EEG, MRI, the genetic test, as well as medications also. So the management is mainly a multidisciplinary approach. What is our main goal in treating or giving therapy to a child with autism spectrum disorder? Our main goal is to help child control the overall core symptoms that he has. That is, the impairment in social communication, all the restrictive and repetitive activities. We help them control all these things so that he becomes independent, he becomes able enough to carry out his activities of daily living. That's the main aim of the therapy. Okay. There are even studies which recommend that even 7 hours per week of therapy at a center plus home interventions can be helpful in treating a child with an autism spectrum disorder. Okay, so this was just about the theory part, how to identify. These are some situations, or this is a troubleshooting where I'll be presenting some major concerns which we have come across and which studies have come across. But when I say these dialogues, you will understand that all these were situations which you have come across too. So the first thing, most of the parents who come to our OPD ask a question. Is it a new disease? Is it that the number of children with ASD is increasing dramatically? Rather, they would ask, are we over-diagnosing them? And what are the recent changes that might have led to this? Is it a new disease? No, it's not. As early as 1925, a Russian psychiatrist had explained that around 6 children had some autism-like features or the facial appearance or a flat facial profile, but because of the various political and language barriers, that did not receive any recognition. It was later in the 1940s when a child psychiatrist, Leo Kanner, described the features of autism that this credit was given to that particular person. So this is a recent study which has been published in Indian Pediatrics in the April 2024 edition. You can see that the estimated prevalence in India is 1.12 per 100 children aged 2 to 9 years. So that means around 1 in every 68 children around us is having autism. So it's not that they are fully autistic or autism spectrum disorder, but they are at least having the autism traits. Okay, so and the next question is, what has happened to the recent surge in all this. From 2018 or 17 onwards, whatever happens in our life, the most important villain that comes to our life is COVID-19 and lockdown. So, in fact, when you look at studies, you can see that COVID-19 and lockdown has been one of the major contributing factors. But the question is it actually the virus or the lockdown that has caused this? Is it the virus that has caused all these issues? No. What happened during the COVID-19 and lockdown has led to all these issues. That is, the social isolation, kids were not allowed to play outside. They had no interaction with kids of other homes, or they didn't have a schooling. They were sitting inside their home. They were sitting in a particular room or a flat. And both the parents were working. Most of them had work from home. They had financial constraints. Parents had their own pressures. They had depression as well as other conflicts, because one was the fear of the illness, one was the fear of the child getting infected, and the one was the financial pressure. Gradually the children had screen time, too much of screen time, that it became a mobile addiction or a TV addiction. There are even parents who report that my child had been viewing this mobile phone as well as television for around 12 hours per day. And the rest of the time the child would have been sleeping or taking a bath or doing something else. So around 12 hours per day. So most of the broken families and parental conflicts led to poor attention being given to the kids. The less quality time being spent with the kids. All this must have led to these changes in the parenting. And all these parenting changes must have led to the various environmental factors which led to different types of autism. So I'll give you scientific evidence for the same. Before that, I think this is very familiar to every one of you. Maybe not very common among the MBBS students or the newer ones, but definitely, though I'm not in 80s or 90s, I definitely had a wonderful childhood with all these things which are given here. Is it true? It is. These are the things which we used to enjoy during our childhood. We used to play with all these things. But this is something that is very new to the kids of the present generation. So this is how we used to spend our childhood or the vacation time once upon a time. But how has childhood evolved over these years? This is what has happened to the childhood now. So even a toddler, even an infant who is just 1 year old, who has just started sitting, she is being given food, and the main purpose of the parenting is to make him eat something, make him drink something. For that, he definitely needs a screen. That is seen in this particular pic. Okay, so there comes the next question. Are mobiles and televisions the real villains? So is technology to be blamed for everything that is happening around? We have studies again. This study shows that screen is a critical issue in child's neurodevelopment. They put children at risk of developing ASD. We have other studies too, which show that there is an association between screen time exposure in children at 1 year of age and autism spectrum disorder at 3 years of age. The percentage is given as 0.4%, but that is very high according to different studies across the world. And boys were 3 times more likely to be affected. In almost every study, the boys were more affected. I don't know why that has been happening, but it is a fact. So when we go into more of scientific details, this is not a very important slide for every one of you to remember, but I was just giving a proof that screen time has got a significant influence on the various neurotransmitters, the melatonin, the dopamine, and all these concentrations inside the brain, because that is given in all these 3 studies. And that shows that all these addictions can bring about neuroanatomical as well as physiological changes inside the brain, which might be a reason for the developmental concerns that you see in kids with increased screen exposure. So why go to international studies when we have our own study, which was done by our HOD of Pediatrics, Dr. Jijo Joseph John and team, which shows that there is an association of screen time with parent-reported cognitive delay in preschool children of Kerala, India. There, the children without a supervised screen time were more likely to have suspected deficits in attention, intelligence, and social skills. Okay, so when we ask a parent to stop a screen time, the next visit they'll be telling me this. We have completely stopped screen time and he just watches TV happily when the advertisements are being played. TV is on most of the time as we elders are watching them. The daily soaps, the daily dramas, and the news channels. That just goes on from morning 8 a.m. to night 12. And the child will be happily playing with his toy, but it's only when the advertisements are being played, the child comes and watches very happily and dances with it. Is that a right thing to do? No. Again, I have proof. This is as early as 2009 when a study showed that audible television is associated with decreased exposure to human adult speech and decreased child vocalization. The study further explains that this causes a reduction in child vocalization, the vocalization duration, the conversational turns, and the adult word count. Even the adult word count is affected, and that definitely will be reflected in the child speech. Okay, that is one major concern. The next thing is lack of awareness. Some mothers say, we felt that he's physically fine because no one can say by looking at him that he might have a problem. But lack of understanding and speech matters a lot. We understood it then. That was a description given by a mother. The most important thing is around 60 or 70% of the mothers who come to the OPD say that the elderly said, boys usually speak later than girls, or it's normal for a child to speak at 6 to 9 years of age because his father also had a speech delay. So it's nothing to worry about. You just wait. He'll just talk just like his father. But they are missing out the main fact that the child is having other concerns also apart from a speech delay. Even an isolated speech delay is not something which has to be waited till 6 to 9 years of age to give the correction. But together with that, the child is having excessive screen time, the child is having all sorts of environmental stimuli, the child might be having some genetic factors because his father also had a speech delay. We are neglecting all those things and waiting till 9 years of age. By then, the child might be having an autism spectrum disorder, which is not a correctable one by that point. And then, again, with the help of a study, this was done in North India to find out the different barriers impacting the help-seeking pathway for an autism diagnosis. But when I went through this study, I could notice that it is not just in North India. In the most literate, the state having the maximum literacy rate, that's in Kerala also, we are facing the same issue because most of the mothers come to the OPD and tell me these complaints. The one thing is the father, the common one, the father didn't speak till the age of 5. He went on to do engineering and he's successful. Our distant relative didn't speak when he was a child, but he's doing aeronautical engineering now. So they have all been successful, so there is nothing to worry about. Then behavioral concerns, the last point, behavioral concerns were dismissed as being either a sign of the uniqueness of a child or harmless childish behaviors like irritability, naughtiness, and bad habits. Some parents say, it is normal for a 5-year-old boy to behave like this. This naughtiness is normally expected because we just have this child at home and we enjoy him doing all this naughtiness. Okay, so the next point, that was lack of awareness. Next thing is, the parents often notice the developmental or behavioral concern in the child. And in some cases, the family members or someone, maybe grandparents or someone told, okay, this child is not speaking just like his father or mother was. But the thing is, they sought advice from neighbors. They sought advice from extended family members. Some gave an advice as to wait and watch. Some said, okay, this might be a problem, but we'll just see. And the study shows that some even went to homeopathy as well as Ayurvedic medical practitioners. This is nothing against the other fields of medicine, but unfortunately this happened and they just waited and waited, but the child's critical period of development got over and the child turned out to be autistic. Okay, this is the next important thing we face now. That's a poor family support. Because the mother says that I'm educated enough, I'm a doctor, I'm a teacher, I'm someone who is earning my own money, but I don't have a say in my child's development. I always felt that my child is having an affected speech, but nobody else in my family was supporting me with that diagnosis, and they said it's normal. So I couldn't take him to a specialist for an assessment. And even after a diagnosis, there have been the numbers, I don't remember the numbers exactly, but there are parents who never knew that something could be done for this. That is, the child was diagnosed to have an autism spectrum disorder that was as early as 3 years, but they didn't know that there are services which help them overcome the situation or at least control their symptoms. Okay, and this is the most important point why I chose this topic for this quest. That's a medical fraternity's attitude. Because in one way or the other, a doctor, an MBBS doctor, a physician, a pediatrician, or maybe a staff nurse who is working in the hospital, or maybe someone to do with the medical field, like someone who has a contact with the medical fraternity. They might be the first contact persons for your cousin's child, maybe niece, nephew, or maybe your neighbor's kid. You are seeing them. Maybe they'll just come and ask you casually, my child is not speaking well, my child is just uttering few words, but he is not having enough of a social interaction. He doesn't play in a group. Do you find anything abnormal? the most common response that has been observed from everyone, including the medical fraternity, is we'll just watch. So that watch continues, the clock is ticking, and the early developmental age gets over. So that's one of the main concerns. So at this point, the point that we would like to make it clear is, maybe the grandfather has been admitted. It's the grandmother has been admitted. But you take rounds, or maybe you're a staff nurse who is taking care of that particular patient. You just go to the room and you see that a child is playing at one corner of the room and having all these abnormal features. Maybe not in a way offending them, but you can just casually say, is a child speaking well, or is a child speaking normally for age? And you can even, if you have time, you can even try to play with the child. And if you find that something is abnormal, at least tell them, take him to his pediatrician just for a visit and have a look at his development. Maybe that might be a turning point in a child's life. So the next thing is a coexisting medical condition. There are a lot of parents who think that the child has gone to the play school and has started getting recurrent pneumonias, recurrent respiratory illness, all illnesses and fevers, because of which the child was never taken to the therapy center, or a therapy or a home intervention, and interventions were never given because the child would cry and get another respiratory illness. So this is one thing which is also commonly seen. So these are the major concerns which we see in our day-to-day life. Maybe these situations are relatable to each and every one of you. So we come to the end of the study, but the final question is it curable? So the explanation is well given from the first slide onwards. It's not a diagnosis but a condition. What we are aiming at is to improve his life, to improve his situation. So the prognosis definitely depends on the age at intervention, the intervention appropriateness, the quality, and the presence of comorbidities. The age at presentation is very, very important. Dr. MKC, who is a patron of our Child Development Center, who comes for a class monthly to our hospital, he always says, if the child is diagnosed to have autism spectrum disorder before 3 years of age, there are 90 to 95% chances that he improves with the therapy as well as the home interventions that are being given. Or if a child comes in between 3 to 6 years of age, there are 80 to 85% chances that the child improves. But if a child comes beyond 6 years of age, it's just a 50-50 chance. So the age at intervention is the most important, the crux of the diagnosis. So despite being a lifelong, early and appropriate interventions can lead to significant developmental progress and positive clinical outcomes for individuals with autism. Children learn by imitation as well as interaction with parents. So let's make their childhood very special by being there for them, by giving a quality time for them, by being someone who acts as a pivot or becomes a turning point of their life. So here comes an end of my presentation. When I was preparing for this presentation, I just went through one of the prayers which were written by one of my fellow developmental pediatricians for parents of children with developmental needs. I think this is something each and every medical personnel has got to do. We shall all pray so that our children so high, needing no help indeed. So thank you. That's all for today. So I'll be handing over the mic to the next person, that is Neethu. That's our developmental therapist at Snehadam Child Development Center. She'll be talking much in detail about the various kinds of developmental delays, the normal developmental milestones, the red flags which we can easily identify, and also about early interventions, which you can do at home also, or help your parents do at home. So thank you. Thank you so much.
Good morning all. Thank you for giving this opportunity to talk to you about the normal child development and when you need to be conscious about the developmental red flags and when we have to start intervention. So without time delay, I'm just moving to my topic. So when a child born in every family, each and every family members be very curious how the child is developing, when he starts to sit, when he starts to walk, and when he starts to talk and interact with us. So all these are some developmental milestones. Developmental milestones are a set of functional activities a child can achieve by a certain age of time, and the most children reach this by a certain age period. It can be changed because 4 to 6 months. Some may achieve their activities by 4 months, some may by 6 months. So it's in an age of range. Then development occurs in different domains. The main 5 domains of developments are physical domain, personal social domain, speech and language domain, emotional domain, and cognitive domain. So now I'm going to just discuss about normal child development, when each child has to achieve their developmental milestones. By 0 to 2 months, child give to response. While we talk to the child starts to look at us, child starts to smile with us, and child starts to keep eye contact with the mother or the caretaker, and starts to notice the things dangling and playing around us. And coordinated movements of legs is all the limbs is also important by 0 to 2 months. By 2 to 4 months, child starts to explore with the toys we given in their hands and the nearby objects. Child starts to make different sounds, ooh, ah, and starts to express their feelings. And child would be able to take their hands to the mouth. Then their head balance is developed by 2 to 4 months of the age. By 4 to 6 months, roll over. The child starts to roll from tummy to back and back to tummy. And child starts to respond while we talk to the child. Being used consonant sounds like da 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 ma 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 likes. And child starts to bring both hands and legs to the mouth. Then with support, when we made to sit, child starts to sit by 6 months of age. By 6 to 9 months, child sits without support when we make to sit. Child is able to sit on mother's lap and look for the objects which is falling down and recognize something is missed. By that time, child starts to move, like using creeping, crawling and all. And child starts to understand the familiar persons and unfamiliar persons. While we call for Amma, the child starts to look at where the Amma is. And when we call somebody's name who is around him, he starts to look whether the person is here or not. And child starts to show some gestures like no, shaking heads to indicate his feelings. By 9 to 12 months, child starts to stand by holding on objects and walk by holding the furnitures. And clapping hands will come. Child starts to pick up the objects using his thumb and index fingers. And by the 1 year, child has to say at least 2 meaningful words, at least Amma, Appa or something like that. And child starts to respond to the directions or requests like come here with the gestures. And other than Amma and Appa, sometimes child starts to say 1 or 2 other words. And child starts to imitate our speech sounds. By 12 to 18 months, child starts to walk independently. Then child starts to play with few objects. Social activities like bye-bye, child starts to show. And by the 18th month of age, the child must say at least 5 to 10 words. As ma'am earlier said, we doesn't want to wait for speech. And by the 18 months, child will be able to identify few body parts and understand the familiar objects and peoples in the home. And child must understand at least 50 common words using at the home. By 18 to 24 months, child have good physical coordination like running, climbing up and climbing down and all. And fine motor activities like scribbling, eating by himself, and starts to indicate his toilet needs through gestures. And by the 24 months of age, that means by 2 years, a child must say at least 50 meaningful words and constantly imitates new sounds, whatever the things parents or the other members using to talk in the home. And child starts to name few objects and pictures every day he used to see. And started to speak in 2-word phrases like mama come, give milk and such words. And started to use gestures and words during pretend play as like taking a cup and giving to us to drink. Then he starts to follow 2-step commands just if mama said, pick up your bottle and come, he goes to pick up and come. So that type of two-step commands child needs to understand. And by the 2 years, child starts to enjoy the rhymes and musics what the parents or grandparents singing at the home. By 2 to 3 years of age, good muscle coordination will be there. The child starts to jump in place and starts to play football, throwing balls and all. And imitating household activities is very important. Child starts to watch how the parents or how their family members is doing, and he starts to imitate household chores like sweeping, mopping, and folding dresses and all. Then starts to draw circles, lines, and it is very important by the 2 to 24 months of 2 to 3 years of age, child will be happy with their friends. Or if a child see a child, they initiate to go there and touch and talk to them. Then by 3 years of age, child starts to weaken 2 to 3 words of phrases. At least 50 words of the speech should be understood to the other persons. And child starts to ask why, what questions like these things. What is developmental delay? So now, till now we see that what's the normal developmental milestones up to 3 years of age. Then when we should be conscious when the child has the delay. So we said that child's development occurs in different domains. If child means not reach these milestones by a specific age, then it is considered as the delay. Delay can be occur in all the 5 domains which we explained: physical, social, emotional, communication, cognitive, all domains. Or sometimes it can be occur in any single domain. If delay occur in one domain, as like if the child have delay in speech, it can be exhibited in social domain also. So it goes together. So what are the risk factors of developmental delay? Biological factors like genetic factors, prenatal factors, and perinatal factors. If the child have any genetic issues like Down syndrome, Credochat syndrome, or Fragile X syndrome, whatever it is, the child may exhibit delays. Prenatal factors like if mother has not enough nutrition during her pregnancy period, and if they have any contact with other infectious disease, child may exhibit delay in later. Perinatal factors like premature birth, low birth weight, neonatal asphyxia, neonatal seizures, or any surgical conditions, all these can be lead to a developmental delay. Environmental factors like any exposure to harmful agents, either before birth or after birth, can lead to developmental delay, and if child faces any trauma. And psychological factors like if there is not enough nutrition child is getting, or if the mother has depression or any other psychosocial issues, if child is not getting enough care at home, that means not enough proper stimulation at the home, also can lead to developmental delay. So how we diagnosing a developmental delay? Both by screening and assessment. Screening is a simple assessment what we doing it just using some checklist or intervening the interview with the parents. We are asking about the child's normal developmental milestones and where the child is lag. And while going to assessment, we use defined tools to assess the child's developments. Then what are the red flags we need to be look on each age of the age? By from birth to 4 months of age, if the child is not responding to loud noise, if child not following any objects by 2 to 3 months of age, if child not smiling to the parent or the caretaker by listening to their sounds or voice, if child not grasping any objects by 3 months of age, if we place in his hands, if child is not smiling people other than not only the caregivers or familiar peoples, someone who knew to him also, if not smiling by 3 months, it is to be a red flag. If child head support or head balance is not achieved, not complete head balance, at least 50% of head balance is not achieved by 3 months, it is a red flag. If child is not reaching for objects by 4 months of age, it's a concern. If child is not bringing objects to mouth, sometimes parents say that he never brings objects to mouth, it is also a red flag. Mouthing stage, the child has to bring objects to the mouth. If child not pushing or if not bearing weight well on the legs by 4 months of age, If child has trouble in looking at all the directions or crossed eyes, if we look at the child, if we see crossed eye most of the time, for very young child, to below 6 months of age, crossed eyes are very common. If it is exhibiting in all the time, then we need to be conscious. By 4 to 8 months of age, if we notice, not only 4 to 8 months of earlier also, if we notice any stiffness in the child's hand and leg, we need to be conscious. If we feel floppiness, while we taking the child, if we feel that child is like a rag doll, as like very floppy, then it is to be conscious. If child's head flips or flops down by 5 months of age, it is to be noted. If child showing no affection to the person by 5 months of age, is child not at all bother about his parents or other caretakers, then it is to be taken in account. Child not seem enjoying people around them. If one or any eyes is constantly going in or out, if child is not able to focus objects properly, it is to be taken in account. If child's persistently tearing, eye drainage or any sensitivity light, sometimes sensitive issues is there, so we need to be taken account. If child is not responding to the external sounds around them, child is not looking around where the sound is coming, then we have to be conscious. If child has difficulty in getting objects to the mouth, does not turn head to locate sounds by 4 months of age. If child not achieved rolling by 6 months, it is to be a conscious. If child is not sitting by 6 months, also need to be taken in account. If child does not follow objects with both eyes, is also to be taken care. By 8 to 12 months of age, child is not crawling. If dragging body to one side, some muscle tone issues will be there, so we need to be taken in account. If child is not stand properly when made to stand by till 12 months, if child is not searching for objects which is hidden, that is to be taken in account. If child is not saying any meaningful word by 1 year of age, at least mama or papa by 1 year of the age is to be present. If child is not learned to use new gestures, like if parents says that we teaching him a lot of time bye-bye, but the child is not showing, that is to be taken in account and check where the issue is. If child is not sit steadily by 10 months, if child not showing any interest in plays like peekaboo or patchy cake like that, if child is not babbling by 8 months, by 1 year to 2 years of age, if child is not walk by 18 months, if child fails to develop walking patterns after several months, or gait abnormalities there, if we need to be taken in account. If child not sustaining eye contact, by 1 year of age, child starts to maintain their eye contact for a long time while we talking to them or while we playing songs to them. If child is not speaking at least 15 words by 18 months and not using 2-word phrases by 2 years of age, and if child is not pointing objects, if child wants something, by 15 to 18 months, child starts to show by using their index finger. If now that is not present, we need to be conscious. If child not looking what we are showing to them, that is joint attention. If we showing something and child is not looking at that, there is some red flag we have to be taken. And by 15 months, we see the child does not seem to know functions of household objects like brush, cup, broomsticks, all those things. Child doesn't know how to use these things. Then that means child is not understanding about the common objects at home. And if child is not imitating actions or words by 24 months of age, and is not able to follow simple steps by 2 years. By 24 to 36 months, if the child is frequently falling or difficulty in coordinating while climbing up steps or climbing down, we need to be taken. If child persistently drooling or very unclear speech, that means there should be some issues in oral motor muscles, we need to be taken. If child is inability to make tower, as like in common, if child is not able to play with Legos or building blocks, we need to be taken in account. If child have difficulty in manipulating very small objects, inability to copying circle and copying shapes should be started by 3 years of age. If inability to communicate in short sentences or not involved in pretend play, failure to understand simple instructions, and if not showing interest in other children of same age or nearby ages, and having extreme difficulty in separating from primary caretaker. By 36 months of the age, the child mother can go somewhere out and come. A short period at least, the mother has to be separated. Then what's the definition of early intervention? According to Center for Disease Control, early intervention is a term used to describe the services and supports that are available to the babies and young children with developmental delays or disabilities and their families. Early intervention is not only for the children, it is also for the families. Through the family only we can develop a child's, we can normalize the child's development. What is the concept of early intervention? Early intervention services are designed to meet the child's need in all the 5 developmental domains, and it can be a remedial measures or be a preventive. It is an effective way to address the child's needs with their developmental delays or disabilities. What is the rationale for early intervention? Child learns by their what the child learns very young age is very important for their later competencies. Early learning is the foundation for later learning. Importance of early intervention. Myelination almost complete by 2 years of age, so we must start early intervention before. Neuroplasticity of the brain is more good during the young age of the child. Most of the gross motor and fine motor milestones will be reached before 3 years of the age. The child independently moves, explores, manipulates, and same time learning and acquiring knowledge. Young children are very curious about whatever happening around. And during 7 to 6 months, most children acquire ability to understand most of the language they ultimately use in their regular day conversations. And environment influences learning, and learning are some of the factors that influence the child's intelligence and human capacity. So we need to give best stimulation at home and environment very young age. So what are the aims of early intervention? Early identification of infants who are at risk for having developmental delay. Early identification of developmental delay. Already if developmental delay occurs, we need to identify as early as possible. Accelerate the rate of development. Acquisition of new behavior and skills. If the child has some bad behaviors, we need to change and learn the new behaviors. Enhancement the child to a normal development. Increase the independent functioning of child's activities. Early detection and prevention of secondary handicaps, as like if we identify the child has speech delay, the child may have social delays. So we have to prevent that secondary handicaps. Minimizing the effects of handicapping condition. Early intervention should be very cost effective. Psychosocial support to the family. At what age early intervention addresses? Mainly early intervention addresses below 3 years of age. Early intervention addresses for the children who are at risk for developmental delays, who have already established developmental delays, or all the developmental disabilities, and developmental delay or developmental disability can occur in different degrees of severity, as like mild developmental delay, mild to moderate, or severe developmental delay in CP cases and all, and to all the functional levels of child. Early intervention services are directed to the developmental needs of child from birth till the 3 years of age. Then who all are included in an early intervention team? Definitely it includes by the medical persons, as like pediatricians, neonatologist, ophthalmologist, physiatrist, neurologist. All medical persons are included in early intervention. Then child development, who are experts in child's development milestones and developmental normal developments. Then physical therapist, occupational therapist, speech language therapist, social worker, special educator, psychologist, a dietitian and nutritionist, and not the last but not the least, the family. Then importance of play in early intervention. All the early intervention activities are gone through the play activities. So each and every child learn through the play. Giving right material at the right time help the child to enjoy their play activity and also to learn new things. So while we selecting a toy for the child, we need to be conscious. We need to avoid sharp-edged toys, metal toys, small objects, or painted toys which can cause toxic. While so we must be aware that it should be very colorful and attractive, non-toxic and washable. So how we can help a child at home? That's very important. From birth to 6 months, massaging helps good it's an overall helping the child's overall development. Massaging, not only the physical activity. While massaging, mother talks to the child, touch the child. So the tactile stimulation is the social stimulation is the language stimulation is the. So giving massaging every day helps the child. Then being a social play with mother or caretaker. Then hanging color toys, pom-poms above the child's crib. Talking to the child, giving different sounds and play with the child, playing with rattles, giving floor time is very, very important. By the 3 months of age, we need to give floor time for the child. It helps in child's strengthening and also head balance. And placing tummy on the lap and floor. Tummy time is also very, very important. Then making child to sit on lap by 5 months of age. By 6 to 12 months of age, start playing peekaboo using either dupattas or towels or whatever at home. You can start to play with peekaboo. Then showing mirror and playing with the child. Child can identify themselves and child can look where the mother is, or watching through the mirror increases the child's curiosity. Then playing pate click. Then encourage child to make different sounds by 6 months of age. Child starts to imitate sounds. Singing song for your child, talk to him. Start teach symbol words like amma, tata, come, and those things. Make child to sit more independently. Encourage child to reach toys and play with both hands, picking up small toys. Make him to stand for holding furniture. Encourage child to squat and pick from the objects from the floor. Then 12 to 18 months, make him to sit and encourage to eat self. It is very, very important without showing the mobiles or screen times. Just mother or the grandparents just sit with the child and feed them. They enjoys it. Talk to him for walk around and show whatever the things in the home and outside the home, nearby and all. So it helps the vision development, social development, and also language development. Start to show pictures by 1 year of the age. Encourage child to use more words. Sing rhymes with action songs. Then points the objects' names. For example, the mother or the parent should start to show the objects nearby and distance. Start to show body parts. Encourage to pick up small objects to push and pull toys, cars, trucks, etc. Encourage child to play with building blocks, Legos, etc. Encourage finger plays. Encourage independent walking. 18 to 24 months, encourage imitative plays like household activities, how the doctor looks and all. Those things the child enjoys by 18 months of age. Encourage interactive play with their peer group and other children. Start toilet training by 18 months of age. It is very, very important. At least 18 months of age, we need to start toilet training for the children. Let the child to eat by himself. Explore the child while eating. The explores and learns fastly. Starts to play hide and seek. By 18 to 12 months, starts to ask simple questions. What you want? You want milk or not? Just ask to the child, so the child understands. Starts to teach proportions like keep it on, keep it under the table, take it from the sofa, like that. And starts to teach body parts and encourage naming them. Introduce action songs and stories to the child by 2 years of age. Pointing pictures. Then child starts to play good coordination using Legos. Then stacking cups, stacking objects, all those things they will explore. Placing shapes like circle and square must be started by 2 years of age. Then scribbling using crayons and pens. Playing with dough. Walking up and down steps by holding on the stairs. By 24 to 36 months of age, encourage pretend play. Encourage group play with peer groups and start to teach brushing, undressing and dressing. Self-help skills also to be started. Include them in area household activities like keeping the vegetables aside, or holding certain things as from one room to another room. Include them. Give them 2 to 3 step commands as like go, take the bottle and come. As like this, 3-step commands must be given to the child by 24 months of age. Teach the child to name their name. We start to teach their name, their gender, then ask simple questions, why, when, who, all those things. Encourage to use 2 to 3 word phrases. Read simple stories to the child and ask questions to them. And teach what is big and small, more or less. And enjoy seesaw, blowing water. Different types of play activities must be added. Pedaling tricycle can be started by 24 months. Then crossing obstacles as while they're walking around. Balancing on single legs, beading activities, introducing 2 to 3 puzzles also can be started. So this is my topic all about just what are the developmental milestones, developmental delay, and how we are diagnosing if a child have developmental issues, understanding the red flags, and why early intervention is important and how you people help the child at home. Thank you.
Thank you very much, Dr. Alphy and Neethu. That beautiful presentation, put a lot of work behind it. I think we should bring some of this presentation as a booklet or handout for the parents. So we'll work on that. And I had an interesting experience after COVID when I came back here. We had about 25 to 30 parents came to me, told their child was talking well, born normal, talking well. And now they are only talking like Tom and Jerry and Bear. They're not using any other words. And simple thing, they couldn't look at eye-to-eye contact was there, they're distracted. So after detailed assessment, we found that they have a condition called CDD, Childhood Disintegrative Disorder. It's an autism spectrum disorder. It was an eye-opening for me. It's not 1 or 2 child, it was 25 to 30 children brought by the parents after COVID. And about 8 or 10 of that parents were our staff members' children. So when I found that these children, as mentioned earlier, was using screen time about 12 to 13 hours a day. It was convenient. It was very peaceful. And even some of the parents were abroad. The grandparents were taking care of the child. And the grandparents told, even appi idam vare phone illa dokkathilla sare. Pinne njan endo cheyana. അവൻ അപ്പിയിടത്തില്ല ഫോൺ കൊടുത്തില്ലെങ്കിൽ. പിന്നെ ഫോൺ കൊടുത്തില്ല തലയിട്ട് ഭിത്തിയിൽ ഇടിക്കുക. എന്ത് ചെയ്യാനാ? അൺഫോർച്ചുനേറ്റ്ലി നോർമലി ദൈവം തന്ന ഒരു കുഞ്ഞിനെ, ജനിച്ച ഒരു കുഞ്ഞിനെ നമ്മുടെ അറിവോ അറിവില്ലായ്മയോ കൺവീനിയൻസ് കൊണ്ട് ഓട്ടസിലോട്ട് തള്ളിവിട്ടു നമ്മൾ. അവിടെ ഇരുന്ന് പല പേരൻസും ഏങ്ങലടിച്ച് കരയുകയായിരുന്നു ഇത് കേട്ടപ്പോൾ. ബട്ട് ഇറ്റ്സ് ടു ലേറ്റ്. ഇവരെല്ലാം ഞങ്ങൾ അന്നേരം തന്നെ തെറപ്പിക്ക് വിട്ടു. സം ഓഫ് ദം ആർ റിക്കവേർഡ് വെരി വെൽ. ഈ പറഞ്ഞ പോലെ ഏജ് 3 എന്ന് പറയുന്ന ഭയങ്കര ഒരു ക്രിട്ടിക്കൽ ഇതാണ്. അപ്പം നമ്മളെ കൊണ്ട് ഇങ്ങനെയുള്ള നമ്മൾ ഇൻട്രാക്ട് ചെയ്യുന്നിടത്ത് കണ്ടാൽ ഐ വിഷ് മോർ സ്റ്റാഫ് വിൽ ഹിയർ ദിസ്. നമ്മളൊക്കെ കുഞ്ഞുങ്ങളുടെ, നമ്മുടെയൊക്കെ കുഞ്ഞുങ്ങൾ, നമ്മുടെ 8ഓളം നമ്മുടെ സ്റ്റാഫിൻ്റെ പിള്ളേരായിരുന്നു ഇത് CDDയിലോട്ട് പോയേക്കുന്നത്. സോ ഇറ്റ്സ് വെരി ഇമ്പോർട്ടൻറ്റ് ദിസ്. അന്നാണ് ഞങ്ങൾ കൺവിൻസ്ഡ് ആയി വി നീഡ് ടു സ്റ്റാർട്ട് എ ചൈൽഡ് ഡെവലപ്മെൻറ്റ് സെൻറ്റർ. ഈവൻ ദോ വി ആർ നോട്ട് മേക്കിംഗ് എനി പ്രോഫിറ്റ്, എയിമിങ് എ പ്രോഫിറ്റ്. We are trying to run it without bleeding, but we were convinced that we need a child development center. By lucky God's grace, now we have full staffing. Dr. Alphy has joined as the developmental pediatrician there, and the dedicated staff is working hard. We need all your support. നിങ്ങൾക്ക് സമയമുള്ളപ്പോൾ ഒന്ന് വിസിറ്റ് ചെയ്താൽ നല്ലതാണ്. ഇത് ആയുഷാലയത്തിലെ പഴയ ആയുർവേദ ഹോസ്പിറ്റലിൻ്റെ ഒരു മെയിൻ ബ്ലോക്കിലാണ് നമ്മൾ ഫങ്ഷൻ ചെയ്യുന്നത്. നമുക്കവിടെ ഡോക്ടറുണ്ട്, ഫിസിയോതെറപ്പിസ്റ്റ് ഉണ്ട്, ഓക്കുപേഷൻ തെറപ്പിസ്റ്റ് ഉണ്ട്, സ്പീച്ച് തെറപ്പിസ്റ്റ് ഉണ്ട്, ഡെവലപ്മെൻറ്റൽ തെറപ്പിസ്റ്റ് ഉണ്ട്, സ്പെഷ്യൽ എഡ്യൂക്കേറ്റർ ഉണ്ട്, സോഷ്യൽ വർക്കർ ഉണ്ട്, പിന്നെ വൊക്കേഷണൽ ട്രെയിനിങ് ഉണ്ട്. ആർട്സ് ആൻഡ് ക്രാഫ്റ്റ് നമ്മളവിടെ ഉണ്ടാക്കുന്നുണ്ട്, പിള്ളേരെ കൊണ്ടും പേരൻസിനെ കൊണ്ടും. ആ ക്രാഫ്റ്റാണ് നമ്മളിവിടെ ഫ്രണ്ട് ലോബിയിൽ കൊണ്ട് സെയിൽ ചെയ്യുന്നുണ്ട്. അത് ആ പ്രൊസീജിയർ അതിന് തന്നെ യൂസ് ചെയ്യുകയാണ്. സോ പ്ലീസ് ഹാവ് യുവർ ബ്ലെസ്സിങ്സ് ആൻഡ് താങ്ക്സ് ഫോർ ഓൾ ഓഫ് യു ലിസണിങ്. സ്പെഷ്യൽ താങ്ക്സ് ടു ദ പ്രസൻറ്റേഴ്സ്. ലെറ്റ്സ് ഓൾ ഗിവ് എ റൗണ്ട് ഓഫ് അപ്ലോസ് ടു ദം അഗൈൻ. Thank you so much, everybody attending. Thank you. Have a good day. Thank you.
Good morning, everybody. I have taken the permission of my HOD, Dr. Jijo Joseph. He is from Vietnam. I just want to make an announcement before you go. Just listen. Please take down the phone number 9495999278. I have been having a CDC CUG number for WhatsApp for parents only. Now this has been made official. Now this is for the autism support group. I intend to use it in the afternoons, but I want to hand this over as a gift to Neethu. Where is Neethu for the excellent presentation that you made? So we will share it on behalf of the Department of Child Health. Can I give this to you? I'll take it over in the afternoon and we'll keep it charged and we'll follow up all our patients who are not returning. Sure. Thank you, everybody.